My name is Abigail DeKeen, and I will be doing the intramuscular injection. I have my badge, uniform, no nails, no jewelry. So first I'm going to gather my supplies. I'm going to use a 3 milliliter syringe. I have a blunt fill needle to fill up the syringe, and then I have a 22 gauge needle to switch before I inject, gloves, alcohol prep pads, gauze, medication. Okay, so now I'm going to do the six rights of medication administration: right patient, right drug, right dose, right route, right time, right documentation. And now I'm going to check the EHR to see what the doctor has ordered. So the doctor ordered 6 milligrams IM one time of morphine sulfate. What we have 4 milligrams per milliliter. So to do the dimensional analysis, that would be 1.5 milliliters of morphine sulfate that we were giving. So I'm checking the MAR, and then I pull the medication out. I'm checking again. My third check will be in the patient's room. So I have my supplies, and now I'm going to go into the patient's room. Set it down on a clean, dry, flat surface. Hand hygiene. Hi, my name is Abby. I'm going to be your nurse today. Can I please have your first and last name and your date of birth? Check. Okay, thank you. Do you have any allergies to medication, food, seasonal, anything? No medication? Okay. So now I'm going to the education part. So today I'm going to give you an intramuscular injection of morphine sulfate. We are going to give you 1.5 milliliters. Morphine sulfate is an analgesic, so it since this medication acts on the central nervous system as a pain reliever, and it it rescinds like your response to pain. So that's what the medication does. It is used to treat moderate to severe pain. Some common side effects could be nausea or constipation. Some adverse reactions, which if this happens, we want you to tell us immediately. Could be tachycardia, or slowing your breath, like if you're breathing, your respirations are slowing down. So if those happen, please let us know immediately, because we need to do something about that. Do you have any questions for me? No? Okay. So with this injection, you may also feel slight burning or stinging. It's completely normal, but I just want to let you know. Okay, so I'm going to apply hand hygiene, and I'm going to put my gloves on. Okay. Now I'm going to check the MAR again. So the doctor ordered 6 milligrams. We have 4 milligrams per milliliter. Dimensional analysis means that we are giving 1.5 milliliters of morphine sulfate. So I am going to grab my syringe, throw it away. I'm going to connect my blunt fill needle to the syringe. Okay, and throw that away. And then we are going to inject 1.5 milliliters of air into our vial. Okay, so now I'm gonna take off the cap. I'm actually going to recap this because I need to clean my vial first before I do all that. So I'm gonna take my alcohol prep pad, clean my vial off, the rubber stopper, throw that away. And now is where I would put my needle on and do 1.5 of air. Now I'm going to take my cap off. I'm going to inject the air into our medication. Okay, so we're injecting the air into the medication. Okay, and now we are going to invert the vial and pull out 1.5 milliliters of morphine sulfate. So we want to make sure we have no bubbles. And then we're going to tap to make sure there's no bubbles. We may also have to redo the injection. So I have too many bubbles, so I'm going to insert it back in and redo it. So I'm going to pull it out again. This time we want to make sure there's no bubbles. Okay. So I'm going to tap again. All the bubbles are out. I'm going to pull this out. Okay. And I'm going to recap my needle using the one swoop method. Put that on. And now I'm going to check with the MAR. 1.5, 1.5. I have 1.5. Okay. And now you would never inject it with the blunt fill needle. So now what we do is we change our needles. This is the 22 gauge needle. So I'm going to open it like this. I'm going to remove this one and dispose of this in my sharps container. Now I'm going to take this one and I'm going to twist it on. Dispose in my trash. Okay. This is my 22 gauge needle. It is capped. I have the 1.5 milliliters. I checked for the third time. So I'm going to set this aside. Next step for intramuscular, we can give it in 3 places. We can do it in the deltoid, the ventral lateralis, or the ventral gluteal. So my patient wants it in the ventral gluteal. So to do that, we need to do like the V. So we're going to place our palm, and this is where we're going to find our injection site. So first I'm going to inspect the site. I want to make sure there's no bruising, no inflammation, no edema. I'm also going to make sure, I'm going to palpitate it to make sure that there's no masses and no tenderness. If there was, we would rotate and go to a different site. You also don't want to give multiple injections on the same site, so you always want to rotate your sites. So now that we have that, I'm going to place the palm, the heel or palm of my hand onto the patient. For this, I'm kind of going to go back just because I have a very small place to work, but I would put my hand like this. I want my thumb to go towards the groin, my pointer finger towards the iliac spine, and my middle finger towards the iliac crest. And then it's in a V, so the middle of that is where we want our injection site. So that is our injection site. Now I'm going to take my alcohol prep pad, and I'm going to start from the center and clean circular. I'm going to do a circular motion going 2 inches. Okay. So now that our site is clean, we do not want to touch, we don't want to blow on it, we don't want to wave our hand to let it dry. It needs to dry all by itself. Now for intramuscular, we do a 90-degree angle. We're going to use our ulnar part of our hand to press against it, and then we're going to push with our, like these, thumb and pointer finger, push against it, and then 90-degree angle. And when we're giving the medication, we want to do 10 seconds per milliliter. So I'm going to start right now. I'm going to push this down, and I'm going to use my 2 fingers. I have a small place to work, but I wanted you to know that's what I'm actually doing. And I'm going to spread the skin, and then I'm going to, first I would uncap my needle. So ulnar part of our hand, take this, spread the skin, 90-degree angle. We're going to insert it. We're going to stabilize the syringe with our 2 fingers, and we are going to give the medication in over 10 seconds per milliliter. So now we're going to hold it there for 10 seconds, just so that it gets to the muscle. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, Then we are going to pull the needle out, take our gauze, cover it. This immediately goes in our sharps container. And we are going to gently wipe anything. There is no blood, so we don't need a Band-Aid. Throw that in the trash. Do not massage the area, and don't put pressure on it. So that is the end of our, that's how you do the intramuscular. Now I'm going to make sure the call light is in reach. I'm going to put the bed at the proper, lower the bed. I'm going to ask the patient if they are comfortable, if they need anything. Are you comfortable? Do you need anything? Patient is okay and they are comfortable. Now I'm going to remove my gloves. I'm going to hand hygiene. And I'm going to gather my stuff and, these go in the trash. Hand hygiene. And I am going to go document what I just did. Thank you.